Yeah, good morning, everyone. I'm Rima Khabbaz, a member of the forum and help on the organizing committee. And so my co-moderator, Rafael Obregon, this morning will say a few words. I mean, as Jeff said, our aim this morning is to then, focus, bring the discussion back to recent events, learn from them, and go forward from there. Obregon's going to say, Rafael's going to say a few words.
Thank you, Rima. Good morning. Well, first, let me say it's an honor to have been part of this process and really excited to see that the forum has taken on this particular issue. And we look forward to the report that will consolidate the discussions and some of the issues that have been highlighted. I lead the Communication for Development section at UNICEF New York. And our area of work is the section that essentially engages in a range of development issues, including humanitarian action and emergency response. And certainly in the context of the Ebola crisis, we were co-leading the social mobilization pillar along with governments and other partners, including WHO, IFRC, and others. So for us, this is a very interesting space to reflect on some of the lessons and challenges that we faced in the context of the Ebola crisis, but also learning from other emergencies in which we have engaged over the past several years. I was just reflecting that yesterday, for instance, when we were speaking about Zika and Ebola, actually in the last year, our teams in coordination with WHO have engaged in at least, if I remember, 6 outbreaks: Rift Valley fever, cholera, measles, Zika, Lassa fever, and I may be missing 1 or 2, but certainly it's an ongoing challenge for us. So this continues to be a very important aspect for our engagement at field level. The second point I like to make is that certainly I think the panel that we have structured for today, or the 2 panels, the 2 sessions that we have structured for today, in many ways, I think we'll address some of the questions that were raised yesterday. I was reflecting on the fact that, for instance, in some of the sessions which were focused on research, inevitably there were questions that were raised by members of the committee that spoke to issues of implementation, issues of capacity that I think will be covered in our discussions today. And then the third point is just in terms of the context in which we thought about the sessions today was moving into a greater focus on some of the issues that we face in international contexts, particularly in areas where perhaps public health systems are not as strong as they may be in the US or in other countries, or where contexts where capacities perhaps are less strong and where the challenges may be significantly different. And in doing that, then we wanted to frame the discussion on 2 levels. The first one is to learn from the field. And Rima will introduce the first session. And that session is about hearing from colleagues who were very much engaged in the response on the ground. And we're pleased to have Reverend Sumo certainly online as well. The second session then will focus on the fundamental question that you raised for this discussion, which is about how do we strengthen local capacities to respond more effectively, more predictably to emergency situations, and addressing challenges related to how well prepared can we be to mount a solid communication response that actually brings people to the center of that response. And that's where then we'll look at some issues related to the international health regulations and to how we can look at the positioning of communication capacities within public health systems. So that's the overarching framing that we, as a committee, thought for this particular session today. So I'm going to turn it over to Rima to introduce the first session, and then we'll take it from here.
Thank you, Rafael. So with that, I think we should move into the first session. So we have three speakers, and it's a pleasure to introduce them to you. And our first speaker, as Rafael said, is going to join us live from Liberia. He's Reverend John Sumo, Director of Health Promotion at the Ministry of Health and Social Welfare in Liberia, leading there in his role the development of messages, community engagement, media engagement, risk communication for the country. And he, he led the Ebola, the efforts for social mobilization, led the committee there and the efforts to respond to Ebola in Liberia. So we'll hear from him. Following Reverend Sumo, Dr. Julianne Anoko will talk to us. She on her experience then in Guinea also with Ebola. She's a social anthropologist from the Sorbonne University, have for many years been involved in epidemiology and public health, providing support to a number of NGOs, WHO, UNICEF and others. And during Ebola, then she led the UNMIR efforts in Guinea to coordinate communication. And then our third speaker is Dr. Catherine Lyon-Daniel from the CDC. She's our Associate Director for Communication at CDC, and as such has led our external and internal communication to put the best information out there. So she is also going to reflect on the experience we've had helping with these responses, Ebola and Zika. So with that, Reverend Sumo, I see you're here. Welcome, and thank you so much for doing this, joining us today.
Well, thank you very much, Rima, and also to Rafael, Obregon. I like to express our thanks and appreciation to the organizers of this workshop for extending us an invitation to be a part of this whole process. We highly appreciate it, and we say thanks to the U.S. National Academy. It's unfortunate that we could not join to be present physically in Washington. It was due to some flight problem. I think the flight was overbooked, and some of us were turned back. But never mind, we are here to just contribute, and they say thanks ever so much for the effort to have us connected to make this presentation. Once again, thanks to the organizers. And may I just take this time to do this presentation. Our focus actually is on the Ebola crisis instead of Zika, because we haven't had any kind of a outbreak as it relates to Zika. So I will start the presentation first looking at the lessons from the field, the role of data and evidence in Ebola outbreak in Liberia. And of course, so on this day, so we say thank you, and as I go through the presentation. Just a second. Okay, the presentation has a map of Liberia showing the countries that surround us, and it has the various counties and the capitals of those counties. So I just want to show a pictorial view of Liberia, where it's situated on the west coast of Africa. You see Abidjan, Cote d'Ivoire, Guinea, and then Sierra Leone.
Excuse me, Reverend, can you possibly share your screen with us? So we can't see the slides currently.
Oh, okay. Just a second.
I'm not sure what to do. Share screen. Right, this one. Yes, just click on. Yeah. Can you?
Is that okay now?
No, we still see you. I think need to click on the share screen so that we can see it.
Okay.
Yes, the arrow is on it. Just has to be. No, it disappeared now.
Yeah.
Share screen at the bottom.
Yes, somewhere on the phone.
I think we can do it from here.
Who's controlling the?
Can we do it from here, back of the room?
Okay.
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 Okay, here we are.
Can we click on the desktop and then share the screen?
No.
Share screen or just screen?
Yeah, we have it,
Okay.
and maybe you can tell us to change slides if we can.
Okay.
Yes.
Okay. Yeah. Okay. Okay. So is that
we're
okay?
good. Yes.